then this child becomes this child. Okay, with thyroid hormone replacement. So it's got to be picked up. You know, the places where you find these kind of problems is in rural areas where you don't have ready access to skilled pediatricians, where your parents might take you to the large animal vet. They may not pick it up.
So do these people have to take thyroid hormone for like their entire life?
For life.
Yeah.
Yeah. That's not a big deal.
Just asking.
Yeah, I eat a Hershey bar every day. I mean, I could take a pill every day. We do things
That's
every
his
day.
breakfast.
Huh?
It's your breakfast.
Yeah, that's kind of my breakfast, but I do like to go to PJ's and get some more stuff.
You have the chocolate croissant or whatever.
Oh, it's really good there.
I like the strawberry.
You like the croissant?
No, not the croissant. It's like a Danish, like cream cheese, strawberry.
What do you call it?
You'll have fun.
I guess it's like a
breakfast.
Danish.
Okay.
Captain Crunch.
Now, adults who have hypothyroidism, we don't call them creeps. We call that condition myxedema. Okay? And of course, as we've discussed, it's associated with low metabolic rate. And because they can't generate heat, one of the common features of people with myxedema is sensitivity to the cold. They're very sensitive to the cold. So it could be the dead of summer and they want the heater on. It always causes conflict with their significant other, husband, wife, or so. They're always fighting over the thermostat. Of course, you fatigue easily, you're more lethargic. Your skin tends to become dry. And by the way, so does your hair. It becomes coarse and it can begin to fall out like that. It's marked by constipation, decreased mental alacrity. They're not as sharp as they used to be. In fact, you know, if hypothyroidism becomes severe enough or it's prolonged enough, it's more than just lethargy. You know, if it's severe enough or prolonged enough, people can develop what's called myxedema coma. They can eventually become stuporous or obtunded and then finally comatose. So you can see changes in the voice, it becomes deeper. They develop puffiness around the eyes, slow heart rate. We said that if untreated, it can lapse into myxedema coma. Patients may or may not have a goiter. A goiter is an enlarged thyroid gland. And here's what's interesting. Oftentimes it's a reflection that the patient may have a thyroid disorder, either hyper or hypo, but it's not specific for either. Here's a lady that's got the look of hypothyroidism. Oftentimes these patients have kind of a dull, expressionless faces. You can see the puffiness around the eye. You can see that her skin kind of looks coarse and dry. She just doesn't look friendly. Okay? You can tell she's starting to lose some hair up here. And she's complaining that the waiting room is too cold. Okay. Back in the early days of our country, there was a president who proclaimed that we needed to expand westward. In fact, he created something called the Monroe Doctrine. Did y'all hear that? You got to study history. What is the Monroe Doctrine?
Told them that they needed to expand westward.
Yeah, right. That's basically, at the time, the United States was really just the eastern seaboard. That's all it was. And what it says is that all of that territory west of that God wants it for us. And so that even though the Indians were settled there, there were all kinds of tribes, that we should then excrew them and just move west. You know, hence it's saying, go west, young man, go west. People giving out free property. Well, you didn't own it, give it away, for people who are willing to move west and settle. to expand America. Okay, so here's the problem. Okay. That was America. Okay? This was America right here. And what the doctrine said is that we should expand all the way over here. So when people began moving west, say they started moving into little pockets here and here and here, a disorder, thyroid disorder, started cropping up. Okay? These people started developing goiters, and because they were present only in these geographic regions, these goiters were called endemic goiters. The term endemic means that it's kind of confined to a specific geographic locale. Endemic goiters. And these endemic goiters, what do you think the goiters were related to?
The lack of seafood in their diet.
Lack of seafood in the diet, yeah. As people moved west at the time, we didn't have refrigerated rail cars. They were moving away from sources of seafood. And so their diet was lacking in iodine. So without iodine, you can't produce what? You're going to have low levels of T3 and T4. Now, in response to that decreased production of T3 and T4, what does the pituitary do?
Produces more thyroid hormone.
More, not thyroid hormone, but more, say it, pituitary, anterior, what is it? Go with it. Just say it. The think method, just say it.
I don't know, that's what that would
Just say something, just say something, say anything.
Growth hormone.
Okay, great. It works every time. Yes, it's one of the pituitary hormones, okay? But, okay, the only difference here, the only correction I have to make is instead of growth hormone, it's TSH. because low levels of T3 and T4 wouldn't stimulate release of growth hormone. You'd lose the negative feedback, and so you'd produce TSH. But
I
yeah,
knew that.
the think method works every time. Okay? So then, as you produce more TSH, that's going to stimulate the follicular cells to produce more thyroglobulin. Okay? And so these follicles expand. And as the follicles expand, what happens to our thyroid gland? It gets bigger and bigger. The problem is then we don't have the iodine to iodinate that thyroglobulin. So even though our thyroid gland is filling up with thyroglobulin, we're not releasing T3 and T4. So without T3 and T4, we can't shut down production of TSH. So TSH keeps whipping the follicular cells, produce more, and it's filling up these follicles, but there's no T3 or T4 because we don't have iodine. So this type of goiter would be called an endemic goiter, but unlike other goiters, it's not associated with hyperthyroidism. It's associated with hypothyroidism. Isn't that interesting?
It is.
Yeah. On the other hand, someone who is hyperthyroid, the most common cause is a condition called Graves' disease. You have to be very careful when you tell a patient that they have Graves' disease. Okay? Because they immediately think what?
They're going to die.
They're going to die. Yeah. Whereas Grave was just the name of the doctor who first described the condition. Dr. Grave. Okay? It is an autoimmune disease. What does autoimmune mean?
Your cells attack themselves.
Our immune system attacks self. Did y'all? I've mentioned this before. When you have little siblings, when you have kids, like I had a little sister who was like 10 years younger, and I didn't interact with her much, except every once in a while I'd come up to her, and because I was bigger, I could say, "Okay, why are you hitting yourself?" You know, like that. And she would start calling my mom and get all upset. Okay, but that would be kind of analogous to an autoimmune disease, where our immune system is attacking self. Okay. In this case, the way it does so is to produce antibodies against the TSH receptors. Okay? So, I'm just drawing a thyroid here. So instead of showing the receptors on the follicular cells, let's say here, the receptors here. TSH. These antibodies, when they attach, instead of inhibiting activation of the receptors, they turn them on. So sometimes we'll call these antibodies LATs, which stands for long-acting thyroid stimulators. So they drive production of T3 and T4. So this is by far the most common cause of hyperthyroidism. Now, if you suspect someone of having Graves' disease, you check TSH. Is TSH going to be high or low?
High. Low.
Low. Low. Not high. Low. Okay, on the other hand, T3 and T4 are going to be high. Okay? The symptoms are just the opposite. They have increased metabolic rate, so they're generating more heat than normal. They're going to be sensitive to the heat. Okay? They always want it colder. They always want the thermostat down. Keep it cold here. Everyone else is freezing. They're wearing jackets. They're comfortable. Okay? They sweat a lot because of the heat sensitivity. They tend to be nervous. They'll have a fine tremor with hands outstretched. Their skin, on the other hand, is very moist. Oftentimes you'll feel the skin and you just don't want to let go. Oh wow, that's nice. Okay? Their hair, instead of becoming coarse, becomes finer. They can lose weight despite good appetite because they're burning those calories. They have an elevated metabolic rate. And what's interesting is they develop this mucopolysaccharide behind the eyes, within the orbits, that causes the eyes to become more protruded. Okay? They also have this similar type of mucopolysaccharide that develops in front of the tibia, so it gives an appearance of swelling or pretibial edema. The condition, okay, so this is from a study that shows different signs and symptoms that were associated with patients with Graves' disease or thyrotoxicosis. Look, at number one is nervousness. Hyperhidrosis is way up there. That means they sweat too much. Hypersensitivity to heat, about 90% of patients. That's lots of fatigue, weight changes. Tachycardia, a rapid heart rate. Not surprising. Okay. What else is big? Hyperorexia, that's increased temperature. Eye complaints, like protruding eyes, about a little more than half. Now, the name of this condition where the eyes kind of bug out is called exophthalmos. Exophthalmos. Oftentimes, you can see the white of their eye completely encircling the iris, which you shouldn't see. It's only because the eyes are being bugging out and being protruded forward. Yeah. Make sure you know how to spell that word. Exophthalmos. That's a good word. I think that we will stop here. Now, if anyone in here, I'm looking, is coming on the trip tomorrow, we changed the departure time to 6:45. Okay, and we're meeting in the lounge.
Is that an extra hour?
Well, the concern is that because we're driving over there during peak traffic hours,
Oh, okay, yeah.
it's going to slow us down. And so we don't want to be late for the lectures.
I got you.